recording. Looks like it's recording. So yeah. So I hope I have got battery. No, I got battery. Like I said, we're gonna start with the back, and the list is not by accident, my good friends. That's how we're going to discover the muscles. We start with the back because it's a bit easier to do the back muscles, and then we go to the uh, ventral trunk, like I said. And I was saying that there are three muscles in the cat that are not in the human. And the first one would be this one here. This pector antebrachialis. Oh, I did a good job of removing the connective tissue. Can you see it already? Looky here. This is the pector antebrachialis. So dash dash dash. If you for the human, or you can just say no equivalent. If I happen to ask you to identify it, okay. But then there are times when I just ask you to list the cat muscles that are not in the human, and in that case you just name it. You go to the next. So this is the first one. The the pector antebrachialis, and the other one is here, which is the in the medial side of the arm. Okay, do you see how I'm using my blunt dissection technique with a blunt probe? Is that what you see number 11? Blunt probe. Okay, my good friends. Again, don't discuss this with the group B that comes on Friday. You know what I'm saying? Unless you want to do better than me.
You were doing because
Yeah.
I thought I got them right, and I
Yeah.
ended up getting a pretty low score.
No, no. Sometimes it's the spelling or the list, because I can put all the possible versions of the answer in there. So, but I'll go through review. So I got a lot of
Oh,
work over
okay.
the weekend.
Oh, okay, okay.
I want you watching movies. I'll make sure I I'll make sure I go through to make sure you get the credit. Okay. So don't worry about it. Your score is only gonna go up from what you have,
Okay.
because there's some like the round scissors, round end scissors, the blunt scissors, pointed scissors, sharp end scissors, all those deals. And some of you may enter the answer exactly as in the list, like scissors pointed, and in parentheses it will mark it as incorrect. You know what I'm saying? But so not to worry about that, my good friends. You understand? I'll go through, and you will see when I've gone through, because I put comments in there. Yeah. Okay, my good friends. So the pector antebrachialis dash dash dash, the epitrochlearis dash 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 is in the medial side of the arm, and then the final one would be the cordofemoralis dash. Oh, I'm loving this cat. The muscles are coming up real nicely. Before we even done that. So this would be the cordofemoralis dash dash dash. So there are three of them. Okay, there's four actually, but the fourth one is not on the list. This is hyphihumeralis, which is down here. Okay, because this is the pectoralis minor and this is the pectoralis major. So minor, and then the xiphiumeralis is the last one here. This from here to there. This is the xiphiumeralis. It's also not on the. You will see it in the label diagrams and so forth, but I just didn't have that in there. But I have the cordofemoralis in the back, in the thigh and hip area, and then the pector antebrachialis. Pector means on top of the pectoralis major. Anterior brachialis goes to the arm, which in this case is a leg. You see what I'm saying? But it's still brachialis because this is the forelimb is the upper limb for the human. You see what I'm saying? Pector antebrachialis, it's still because it goes there. It's on top of the pectoralis major. The pectoralis major is underneath, and the pector antebrachialis goes across like that. So most of the time I'll just accentuate it, but I won't really dissect it. And here I'll accentuate the division between the pectoralis major and the pectoralis minor. Okay. Now back to the back. Whew, this one's smelling so bad. Okay, my good friends. So there is that. I should have gotten my dissection instruments. What's that? So I borrowed yours. I'll go get the other ones and give it to you if you're gonna be sitting here. Okay, my good friends. So this is of course the round end scissors, because when you close it, it's round end. It's also the curved scissors, if you like. You see what I'm saying? Okay, so then I'm gonna go give you credit for that. This is the forceps, all right, and then of course this is the blunt probe. Okay, and then there were scalpels. Some of them were disposable, some of them were permanent scalp where blood handles and stuff like that. So you have to be complete like that. Okay, my good friends. So what we do. So in the dissection skills exam, we're gonna start here with the clavotrapezius. Trapezius. Okay. The clavotrapezius is the trapezius muscle, which is this muscle here. So it's coming down like that, but it's going to go over another muscle that is also like a band like this, which is like a thin band that goes underneath like that. So what you want to do first is to identify where that levator scapulae comes. You understand? So if we're like in the dissection skills exam, I'll say if we're dissecting the clavotrapezius, right? What muscle must we avoid cutting? Then you would say levator scapulae, levator scapulae. You understand? Okay, so you see, this is the levator scapulae right there. You see, there's the scapula right there. It elevates the scapula. Do you understand? So that's where I go, because I don't want to cut through this, because some students do that and then we take off points. You understand? Okay, so and we'll be using our blunt probe. Is there a thing that makes this come out? Okay, very good. So, my good friend, what's that? No, for some reason, it makes me my nose run. So I don't know. I'm allergic to cats. Actually, that's true. Somebody had a cat, a friend of mine, and I went to their house. By the time I came out, couldn't breathe. He needed to give mouth to mouth. Okay, very good. Okay, so we are starting here, my good friends. So where the levator scapulae is. That way we make sure we don't, separate. So we're going to go up to here, and then we're going to go down here. This levator scapulae, this clavotrapezius trapezius, becomes, once it gets to the deltoid, to the shoulder area, you see this imaginary line here, it's actually, there's a lot of connective tissue here that anchor this muscle there. And then from then on down to the arm, it becomes the clavobrachialis or clavodeltoid, deltoid. Okay, if you call it clavobrachialis, you still call it deltoid in a human, okay? So you might as well call it clavodeltoid, so you know, you remove the prefix and you get your name. Isn't that cool, my good friends? Okay, so there is that. So we start right here, and I'm using this. Do you see how it's easy to separate? It's not that easy. You just have to have patience, you see? So I'm going to use a combination of blunt and the sharp dissection techniques. You see, if I have my scissors, once I have identified it, and you could see the white is the connective tissue, I could use my sharp end to gain access like this. Do you see what I'm saying? Do you see what and do you see when I'm making these cuts, I'm not making like a humongous cut. Because if I make a humongous cut and I was making a mistake, guess what kind of mistake that's going to be? It's going to be a huge mistake. But if I make small cuts at a time, and I was making a mistake, it's going to be a small mistake. Probably hardly noticeable. Do you understand? That's how you do it, my good friends. You don't want to be like as if you're cutting cloth. Okay. Do you see what I did? I didn't do much, but I've already gained access nicely, and then I could see that. So when I can see my connective tissue like this, I can make my small cuts with my blunt end towards the cat, not like this. You see what I'm saying? Because then this is sharp. You see what I'm saying? Okay, because I identified my levator scapulae first. Do you understand? So we are doing that. You see what I'm saying? And then we're doing that. Okay. Okay. And do you see the cobwebs? Do you see the cobwebs? Then you know that you're doing good. You understand? You know that you're really separating the levator scapulae from the clavotrapezius trapezius. Do you see what I'm saying, my good friends, and so forth? You see, ding. So there's that. Man, I'm loving this cat because it's really separated nicely. And, you try to preserve the female. I mean, not the female, the blood vessels as much as you can. Do you see? Cobwebs. That means we are separating. A good separation. I can see where my thingy is like that. You see what I'm saying? You see my line? Do you see it? That's what I'm following. You see what I'm saying? And then I'm helping it out a little bit when I do this. You know what I'm saying? Do you see how I already separated my my levator scapula? Some of this connective tissue is tough, so you want to cut the connective tissue like that. Some of this cobwebby kind of tissue right there. Do you see my levator scapulae? I really made sure. You see how it's going over here like that? You just follow that like that, and then do you see that it becomes more prominent if I stretch it a little bit? By the way, my good friend Jose, I managed to get a deal with you for McGraw Hill. I'll email you. Okay, very good. All right. Very good. So there's that. So we do that. So there's that. Do you see my levator scapulae? It goes underneath there, and I managed not to cut it because I see several students who cut through this, and you don't want to do that. You understand? Do you see? I started here because of that, and you can see my cobwebs and stuff like that. And you see my levator scapulae? Do you see it?
Is that the blue part?
No. The levator scapulae is this muscle. This is levator scapulae, levator scapulae. Do you see how it was like this? And I started separating there. I wasn't using a lot of cutting instruments, a lot of sharp instruments. Did you see that, my good friends? Can you see over there, my good friend Crystal Salari? You can come closer if you like, I promise I won't bite, try not. Okay, my good friends, so we do that. What's that?
The cat might bite.
Oh, yeah, but we made sure it's not going to bite anymore. Okay. But if you put your hand on the teeth, it'll get you. It's sharp, It's bad. It's really sharp, I'm like, oh my god, it looks like it's smooth, but it's sharp. So here you might cut a little bit of muscle, but you know what I'm saying? I don't mind about that, because that's where the muscle comes here. And you could see here, we might cut a little bit of muscle, and then we come to this connective tissue here. Do you see, my good friends? Okay, my good friends, like this. And then we can continue here, and then we cut here so that we could. Now this is acromiotrapezius, trapezius. You see what I'm saying, my good friends? Bing. Okay, so we kind of get this connective tissue like this, and we cut in the middle. But most of the time we're cutting connective tissue, you understand? So we go like this. Okay. Bing. Okay, my good friends, I take my probe, and then we cut it up to here. We stop. Okay, my good friends. So there's that. Okay, and if I have my deal here, you see what I'm saying? I can do that. It's a cut with an upward forward motion, correct? Upward, you stretch it, and then it's easier to cut. You understand? And then when you pull upwards, you're also removing it from the cat. Even though you've got the blunt end towards the cat, you're still kind of removing the instrument from the cat. Do you see what I'm saying? But it also gives you the ability to cut easier. So it's like a win-win. You never stop winning. You see what I'm saying? You never stop winning. If you do the right thing, you understand? And you could close this, and it's a blunt instrument. You see what I'm saying? That's another thing. That's why we use a blunt end scissors like this. You see what I'm saying? It's making sure the rounded part is on the bottom. Because if you put the sharp end on the bottom like this, it could prick it. Do you understand? Okay, very good. Okay, very good. So there's that. It looks like I'm not doing a lot, but I am. Okay, very good. So now let's do this now. Once we get our connective tissue separated, we can cut. Remember I said over here you could cut muscle a little bit. I don't mind, because then here there's all muscle. But for the most part you're cutting connective tissue, you understand? You see the cobwebs, And then I peel it like a banana. I love bananas, my favorite. Strawberries and bananas. You see, I go to Costco and I buy all these frozen fruits, mangoes, bananas, mangoes and strawberries and pineapples. then I make a smoothie out of it. It's a very hefty protein shake. Okay, let's go. You see what I'm saying? I'm cutting now like that. And I'm always cutting the connective tissue, my good friends. I hope I didn't make you salivate with my protein shake. My good friends. You gotta have fun with it. Okay, my good friends. So we did that. Do you see how I'm kind of step? And I'm gonna stop right here. Do you see right here? See, I'm gonna do that, and then in the meantime, I'm also getting this spinotrapezius, trapezius. I've already gotten the clavotrapezius, trapezius. I've already gotten the levator scapulae, levator scapulae. I've already gotten the acromiotrapezius, trapezius. You see, just like that. And I haven't done a lot, but you know, the muscles that we are revealing is a lot of muscles. You understand? So do you see what I'm saying? Do you see what I'm saying? So there's going to be tough connective tissue right in the corner here. So I'm going to make sure, like that. Do you see that? Right here. And then I'm going to do this. You see, I remove the connective tissue. Do you see what happens? When I remove the connective tissue, you can actually see the fibers, the orientation of the fibers in here. Is that, did I do it? Oh, thank God. I didn't correct. I didn't even check. So you guys, you should do that, okay? Before you start dissecting, you want to make sure you're dissecting the site that doesn't have it. I kind of sort of like went ahead and did it without looking, but so thank God, you know, he hooked me up here because, you know, I'm not doing it this side. Do you understand? So you're gonna leave the side intact, the side that they did an infusion on. Do you understand, my good friends? Okay, very good. I got lucky here because I just went ahead and cut without looking. Okay, so you guys don't make that same mistake. Okay, I made it for you, but I got lucky. Okay, my good friends. So you want to do that. So that's one thing I should have mentioned right at the beginning. You don't want to dissect the side that has. So, you know, once I do this, I can then come here and then I could now go here. But first we need to make sure we are not cutting the levator scapulae, levator scapulae. Do you understand, my good friends? Okay, so here I do the same deal. This is again, I'm going to ask in the dissection